Good morning, everyone. Siobhan, I'm just going to confirm that you can hear me and you can see my screen.
Yes, Amanda, good morning. Good morning, everybody. So I'll begin.
Apologies.
Not at all. Okay, so good morning, everybody, and thank you very much for joining us. This is actually the fourth in our series of Flash Talks. What we are trying to do here is demystify some of the acronyms and language used in GS1 to help you all understand what barcodes can do, and today's talk is titled "What is in a barcode." Just from a housekeeping perspective, this webinar is recorded and slides will be shared afterwards, so you'll be free to listen back or also share with colleagues if you wish. If you have any questions, you can put those in the chat and we'll get to those at the end of the session. So we'll move on to the next slide, please. So just introducing both of us, my colleague who you just heard a moment ago is Amanda Crean, a Healthcare Project Management Executive, and my name is Siobhan Duggan, Director of Innovation and Healthcare, both of us with GS1 Ireland. So the topic today is what is in a barcode, and what we'll cover here are the typical barcodes used in healthcare, the different types of barcodes, what is the information in a barcode, or what information is in a barcode, and then the traceability opportunity. As we mentioned, this is the fourth in the series, so we previously covered what is a GTN, which GTN is this, and how do I find my GTNs? And a lot of these are questions we get regularly when we're out and about with members, with healthcare providers, with suppliers. So hopefully if you have any questions on that, you can listen back to those as well. As a reminder, because I think the GTN is probably one of the key identifiers within GS1, it is often referred to, and we often get questions about what is a GTN. So it is essentially a product identifier. It's a globally unique, it's actually, the definition is a global trade item number, and it's used for unique identification of products. It is a globally unique identifier, which means that you can assign this to your products and can then they can be traded globally without any risk of duplication. And this is I suppose the code that is typically used to identify medical devices and pharmaceuticals and many other products within food supply chain and other sectors. So then we also, obviously today is the topic, the main area is healthcare, and these are the typical types of barcodes that are used in healthcare. Healthcare is moving to the 2D barcode because it can contain more information, which we'll cover in a moment, and also all the information can be captured with one scan. It's probably worth mentioning as well that there was a recent HSE national tender for medical consumables, which mandated information on GTN for each product packaging level. So we're starting to see more and more healthcare providers looking for the GTN as part of the information they would like from suppliers, not just in Ireland, but also in the UK under the Scan for Safety programme and in many other countries as well as part of regulation, which we'll cover a little bit later. In fact, sorry, here's the reminder. So just a reminder, we've covered it before, but there are two regulations. The medical device one is still coming because it got deferred due to COVID. So the deadline is now May 2021. Essentially, it's requiring to have the requirement is to have as part of a bigger regulation around medical device regulation. The UDI piece is about putting a barcode on products using international standard, and industry is working with GS1 on that. Already in place is the Falsified Medicines Directive, so every prescription product has the 4 data elements within the 2D barcode. And I think it's important to cover this slide because this can often create confusion, because essentially here you have different types of barcodes, but they all have the same information. So depending on the packaging or the use and where the barcode is being applied, it is okay. It is perfectly within the standard to apply different barcodes. But what we're showing here is that you've got, for example, the EAN13 is a typical barcode you see in retail and also on a lot of the food products that will be going into hospitals. that is your GTIN, that has your 13-digit GTIN. Similarly, the GS128 also has the same information. I'm a GTIN. This information can also be included in a 2D data matrix, as well as an ITF14, which is typically used on bigger kind of cardboard packaging. So all of these barcodes, the different types of barcodes, would have the same information, and they're read by a barcode scan. The same information around a GTIN can also be included in an RFID tag. An RFID tag doesn't need to be scanned. It's automatically picked up when it passes a reader, be it a mobile reader or a fixed reader at a doorway, for example. So they're the different types of data carriers that can be used to carry the same information. So with that short introduction, I'll pass over now to my colleague Amanda, who will go into the details of what is in a barcode. Thank you, Amanda.
So thank you, Siobhan. So I'm going to speak to you about GS1 standard barcodes and how the data is structured. But what do we mean by standardized and structured? So to demonstrate, see first here, a non-standardized barcode. So this is one that has been produced using an internal numbering system. But when we scan this barcode into a system, all it tells us is that it is a number. But what does this number mean? Is it a patient? Is it a product? Is it a sample? Is it a location? So this introduces a variety of risks into a process, particularly in a healthcare setting, poses a risk to patient safety, as the system, number one, doesn't know what the number is. There is a risk of duplication, as there may be multiple numbers or barcode formats. The use of an internal numbering system also leads to a lack of interoperability, both internally and externally. And as the barcode is not printed to a standardized, to standards, there may actually be issues in scanning the barcode in the first place. Whereas here we have a GS1 standard barcode. So as the data is standardized and structured, the systems will know what the numbers mean when the barcode is scanned. So in this example on the slide, we see a GS1 128 barcode being scanned. So when it's scanned, the system will know that the number is referring to a product, as there is a GTIN, and it will also know that it is from a certain batch. So I'll speak more later on the specifics of how these identifiers work and how the data is structured. But again, as the data in GS1 barcodes is structured, the system will know what the numbers mean. And this is because it is globally unique, so it improves patient safety. The standardized structure of a GS1 barcode means that the system knows what is being scanned. This information can be shared both internally and externally without the risk of duplication. And as it is a reliable and standardized barcode, there are less scanning issues. And again, we see here that, as Siobhan mentioned earlier, the GS1 data matrices are becoming the preferred barcode type in healthcare, as one can encode much more information into a smaller space. So we see here in this example that when the barcode is scanned, the system will know that it is a product. It'll know what its GTIN is. It'll know its expiry date, batch number, and serial number. So how specifically is the data in the GS1 standard barcode structured? So you may know, or you may have guessed, it is using the numbers which is in the brackets before the information. So these are called application identifiers, and they are 2 or more standardized digits added before information in a barcode, and they're used to define what the information means. So AIs or application identifiers are used worldwide, and they're reliably interpreted, and they allow multiple pieces of data to be encoded in the same barcode symbol in a standardized and structured manner. So some examples here, which we have seen on earlier slides, include the GTIN, whose application identifier is 01, the expiry date, which is 17, the batch number, which is 10, and the serial number which is 21. And again, the application identifiers allow multiple pieces of data to be encoded in the same barcode symbol in a standardized and structured manner. So then here we have some more additional application identifiers which are commonly used in the healthcare setting. So we have the one for a patient, which is the global service relationship number. So this is 8018. Then there is also another GSRN, which is specifically for a caregiver, so a doctor, a nurse, or other member of staff within a healthcare setting. And this is identified using the application identifier 8017. So then another one is the asset identifier, which is 8004. And this may be commonly used in a healthcare setting for asset tracking and maintenance management. And then we also have here the example of a global location number, so a GLN. So these are commonly used now to manage delivery points, and you can also scan products, people, and assets to locations within a healthcare setting. So then to summarize, as Siobhan mentioned, barcodes can turn everything into data. And here are some examples of commonly used GS1 barcodes in medical device and for medical devices and pharmaceuticals. So first we have the EAN13. So we see here the GTIN encoded in that. The other one then, the next one, the GS1 128. So this includes the application identifiers for the GTIN and the lot and batch. And then finally, we have the GS1 data matrix or 2D barcode, which encodes the GTIN expiry, batch, and serial. And then the main point here is that they enable unique identification with more traceability in just one beep. So I'll hand back to Siobhan now.
Thank you, Amanda. So I suppose then the opportunity, there are many, and if we go to the next slide. So I suppose we've covered the different the typical piece of information that you can see in a barcode. Majority of, if we look at products now have standardized GS1 barcode, and through a lot of the work that we've been doing with the HSE, and the HSE is also using GS1 identifiers for people, locations, assets, and in programs such as Scan for Safety, both here in Ireland and in the UK and other parts of the world. And the use of, by scanning and capturing the information within those barcodes, such as batch, expiry, means that inventory management can be much safer and efficient if the information in the barcode is used compared to what it used to be, or still is in use in terms of the paper and manual processes. There was a presentation yesterday from our colleagues or at the conference in the GS1 US, where an expert from the FDA on food safety was speaking, and he said that we can, by using the information in the barcode, we can move from first in, first out to first expired, first out. So it's certainly a much safer and more efficient way of operating. The standardized barcode is an enabler in future-proofing e-health applications and adding the improved patient safety, because if a barcode is structured using the GS1 standard, then when it's scanned, the system knows what it's scanning. It knows I am a patient, or I am a staff member, or I am the product, which is really, really important to ensure that you're designing risk out of the system. If you are implementing or involved in implementing any type of e-health solution or any type of system that requires barcoding, think about how a standardized barcode can support the process design. What we're seeing is often at the moment either someone doesn't think about a barcode or it's an afterthought, and then typically someone goes to the web, Googles something and picks up a barcode, but it's not standardized, it's not structured, and immediately that's a gap in the system that it will be costly to fix in the future. So please talk to us to ensure that you're on the right track, and this applies to anyone really within the industry, suppliers and healthcare providers. And I think it's always important to remind what our vision for patient safety is. So using the GS1 traceability standard means that when items are captured, be it in a theatre or in a ward setting or in a community setting, that I am a doctor, I'm a product, I'm an instrument, and the system knows what you're capturing. And that can be either through scanning a barcode or capturing an RFID tag being read when it goes through a reader or passes a reader. Then I think we're nearly finished. So just as an example, I suppose, in terms of how traceability works and traceability in action, and the work that we've done with Temple Street, and that is a published case study as well as a video, well worth looking at if you have a moment, but really documenting the benefits of moving to scanning and barcoding, but particularly by using the GS1 barcode, all the information around the product, the batch expiry, serial numbers captured in one beep. It has really helped improve processes by going from manual to electronic and making it more efficient and safer for patient care. And then resources. So we have a lot of the information that we speak about or refer to is all available on our website, including case studies, guides, and other webinars that we've conducted. If you'd like to receive our regular newsletter, please subscribe to it via this link, or you can find it on the website as well. We are active on social media, on Twitter and LinkedIn. And also, if you would like to talk further to us, we're happy to talk to you. And if you really need to get some guidance, we can talk to you about how we can support you through advisory services or training, education, etc. So without further ado, we'll just announce that our next webinar is I want to use a GS1 barcode, what do I need to do? So again, questions we typically receive, and we'll try and cover those in a simple fashion in the next webinar, which is intended to be run on the July 1st at 10:30 a.m. So I think, Amanda, we might go to some questions now before we close the webinar. Oh, sorry, I should mention our solution provider program. So our platinum partners, IFS, gold partners, ASD, Continuum, De Royal, StoryTrack, True Commerce, and our solution partners.
Well, thank you, Siobhan. So just a reminder, if anybody has any questions, you can type them into the questions panel using the GoToWebinar panel on the side of your screen. But I have a couple here, Siobhan, if you'd like me to start.
Yes, please.
So first of all, here I have, what do I do if there is no GTIN in the barcode?
Yeah, that's a very good question. And I suppose it really depends on what you're scanning. If you're scanning a product, it does need to have a GTIN. That could be maybe a supplier not understanding how information should be encoded. It could also be that there are two barcodes in the product, where the first barcode has a GTIN and the second barcode has the batch expiry information. So I suppose it's really depending on the case that, you know, what are you actually scanning. If it's a product, it does need to have the GTIN, but maybe the GTIN is in a separate barcode. We are still seeing multiple barcodes. However, certainly the requirement or the request from the hospitals and healthcare providers is to have everything in one barcode, because it just means one beep. It's much easier. If you can imagine, busy nurses don't want to have to be scanning multiple barcodes. So certainly our guidance will be to have everything in one barcode if possible. And if there's a further question, we can certainly address that offline.
Thanks, Siobhan. So I think you've covered the next question in that, just if you do want to add anything else, the question is, what do I do if there are two barcodes?
Yeah, so I think I've covered that there. So if there are two barcodes, I mean, the other thing to be conscious of as well is obviously the IT systems need to be able to I suppose, designed in a way that they can capture the one or the two barcodes. What we're seeing, and that is a challenge, is that sometimes the IT system is designed to scan only one certain type of barcode. So if it gets anything else, the system fails. So ideally, if the system is designed with, I suppose, the GS1 spec in mind, then it should be capable of handling one barcode, two barcodes, different pieces of information, can even ignore some information if necessary. So, but that's really part of the system design, and it's simple logic, but it needs to be understood. And again, we can talk to people to guide them on that if necessary.
Thanks, Siobhan. So I have another one here, which is, why do products have different barcodes?
Yeah, that's a good question, and I mean I think we covered part of it on the webinar today. I suppose some of it depends on what the requirement is. So, for example, for the Falsified Medicines Directive for all prescription medicines, they all now have a 2D barcode. It's very much defined in legislation that the product must have a 2D barcode. So we're seeing really high level of compliance across those products. When it comes to medical devices, the requirement is to have a barcode, a unique identifier encoded in a barcode. In this case, the medical device manufacturers are choosing different barcode types depending on typically depending on packaging. So if it's a large product, there's plenty of space for the barcode, and typically they're using a GS1 128, which has a GTIN and possibly batch expiry information within the one barcode. But that takes up a lot of space. So when it comes then to smaller products, like for example sutures or scalpels, small packaged items, there we're seeing definitely the 2D data matrix is what is being applied because it's a smaller footprint. So often the type of barcode depends on the type of packaging. But certainly, I think as all of us gain more experience in this, and particularly as more hospitals are scanning, the feedback from anyone that we meet when we're out talking to hospitals is we would love to have everything in one barcode. One beep makes our job much easier.
Thanks, Siobhan. Then another one here is moving away from the product barcodes. So I want to use a GS1 identifier for our staff badges. Which barcode should I use?
Yeah, so that's a good question, and something that's coming up more now as well as I suppose particularly healthcare providers are starting to look at how they can capture information through scanning. What we're typically seeing is that staff identifiers are 6 or 7 digits long, and we would always recommend that this can be embedded in a longer GS1 number, and we can certainly provide more information on that if necessary. The type of barcode then that would be used was probably, because staff badges are smaller, it's probably a 2D barcode that you would encode. As you've already presented on you would have the application identifier that would go before the number would be the 8017 to indicate I am a staff member. So that's I suppose at a high level how you would approach that. And again, we're happy to take the conversation offline if necessary.
Thanks, Siobhan. So I think we'll just leave it with one final question. So this is more of a question on systems, which is, I just want to capture the GTIN and expiry date. What do I do with the other information?
Yeah, that's a really good question, actually. And I suppose what we're seeing is some people, when they're scanning information from a barcode, they just want, let's say, maybe the GTIN is all they look for at the moment. And they may in future look at the other information, but at the moment they just want to capture the GTIN. But sometimes people think that they have to capture everything or nothing, so I think it's important to understand that because the information is structured, it is possible just to take whatever you want. So it's like you can pick out what you want and then ignore the rest. Now, that's obviously a conversation that you need to have with the IT provider that's scanning the information, but the logic is there, and it's designed in a way that you can ignore information that you don't wish to see. But it is important that the system knows how to ignore it, and that's something that we can again provide guidance on, because it's better to build in that information and then just ignore it. Sometimes if the system doesn't know anything about it, it will cause an issue. So there's a little bit of logic there that we can provide guidance on. So I think, Amanda, as you said, I think we'll probably conclude the webinar now. I'd like to thank everybody for joining us today. I think even just the questions there indicate of some topics for future webinars as well. If you have any of the further ideas that you'd like to share with us around information or topics you'd like us to cover, please let us know, and we look forward to hearing from you again soon. Thank you very much. Thank you, Amanda. Bye.
Thank you, everyone.